Hello, and welcome to the benefits episode of Broward County's Cross Systems Training. My name is Julie Radlauer-Dorfler, and I'm with the Ronick Radlauer Group. Thank you for joining us for this episode in a series of informational presentations designed to introduce you to the services available in your community. The topic of this episode is the availability of benefits and entitlements in Broward County. We're going to hear from 3 representatives from the community that work in the field of benefits. Our first guest is Rebecca Mealy, who is the Florida Kid Care Outreach Manager with the Florida Department of Health in Broward County. Our second speaker will be Billy Morgan, who is a Special Needs and Behavioral Health Manager with 211 Broward. Our final guest today is Ismael Martinez with the Family Success Administration Division of Broward County Government. We hope you find this information helpful when assisting children, youth, and families in Broward County. Thank you, and enjoy this episode. Now, I would like to introduce you to Rebecca Mealy.
Hello, my name is Rebecca Mealy. I am with the Florida Department of Health in Broward County, and I am the Program Manager for the Florida Kid Care Health Insurance Program. Before we get started with coverage of the program, I think it is important to know who needs the program and why. Who are Broward County's uninsured children? They are children that we see on a daily basis. Broward County has just under 30,000 uninsured children. We are the 14th county in the nation with one of the largest percentages of uninsured children. They are no longer from low-income families or from single-parent homes. 90% have one or more parents who are working. 3 in 5 live in households with both parents are working. 2/3 of these children live in households with incomes above the federal poverty levels. However, 76% have incomes below 200% of the federal poverty level, which is the guideline for low-cost health insurance coverage through the Florida Kid Care Program. And guess what? 23% of children who qualify for Medicaid services are currently not covered with Medicaid. Additionally, 1 in 4 workers today have no access to health care coverage at any cost. Construction workers, hairdressers, restaurant workers, and most employers that cover workers do not cover the dependents. Families pay the full cost of coverage for each dependent. Why are they uninsured? The most common reason children are not insured is that the family cannot afford the cost of the coverage. The income is not low enough for Medicaid, but not enough to afford private health care coverage. Parents don't know that they are eligible for Florida Kid Care coverage, or they don't understand the importance of insurance. Here in South Florida, we have a large immigrant population. These families come from countries that may have never heard of insurance, so they have never had it. I can't tell you how many times I hear a parent say, "My child is not sick. Why should I pay for something I don't need?" They don't understand the concept of preventative care or the financial loss of a major illness. What is the Florida Kid Care Program? The Florida Kid Care Program was created by the 1998 Florida legislature in response to the federal Children's Health Insurance Program legislation. This legislation pulled together 4 health coverage programs and rolled them into one umbrella called Florida Kid Care. Medicaid, which is the lower income households, MediKids, which covers children from ages 1 to 4 years of age. Children's Medical Services, or CMS, covers children that have a medical condition lasting more than 12 months. And Healthy Kids, the private not-for-profit coverage that works with providers to provide health care coverage to children at an affordable rate. What does the Florida Kid Care Program cover? Everything related to health care that the child needs. They go to their own doctors because the parents choose the health plan they want from the ones that cover the program. It covers doctor visits, surgeries, mental health issues, prescriptions, glasses, dental cleanings, and checkups twice a year, cavity fillings, everything the child needs. It does not, however, cover braces or cosmetics procedures unless they are medically necessary. What is the cost? Some families that qualify for Medicaid pay nothing at all. Most families pay $15 or $20 per household of children. You heard correctly. It is not per child. It is per household of children. So if there are 6 children in the household, all 6 children are covered under the $20 premium payment. Some programs like Healthy Kids have small co-payments, $5 or $10, for medical services and prescriptions. For families that don't qualify for the reduced payment, maybe their income is over the qualifying amount, they have the full pay option. Families pay the full cost that the state pays the coverage. Contact the local Kid Care office for more information on the full pay option. Who is eligible for Florida Kid Care? Florida Kid Care covers children from birth to age 19 years of age whose household income is at or below 200% of the federal poverty level. Let me put that into perspective for you. A family with any combination of four living in the household could be mom, dad, and two children, or maybe mom, grandmother, and two children, could have an income of almost $50,000 a year and qualify for a premium payment of only $20 per month to get full medical and dental coverage for the children. As the size of the family increases, so does the income allotment. A family of five can earn almost $60,000 a year, and their children would qualify for a $20 premium payment. The children must be U.S. citizen or qualified non-citizen. One application covers all the children in the household and applies for all the included programs, including Medicaid. Applications are available in English, Spanish, and Creole. We can also assist other languages using the Department of Health language line. Who can apply? Parents can apply for children residing in the state of Florida. However, there are similar programs in every state of the United States. The information on the application must reflect the household in which the child permanently resides. If the parents are separated and have joint custody, it would be the parent that claims the child on their income taxes. Legal immigrant children may now be eligible even if they have been told no before due to new immigration guidelines that lifted the 5-year waiting period. For additional information on eligibility status, contact the local Kid Care outreach program. The Kid Care program requires applicants to document all household income, earned income from employer salaries and self-owned businesses, as well as unearned income, such as Social Security benefits and royalties from rents or properties. Some incomes that must be reported may not be included in the eligibility determination, such as grandma's income if she lives in the household. Every effort will be made to verify the income information electronically. However, the family must produce the verification if necessary. Immigration documents. Citizenship documentation is necessary for any child seeking enrollment. If a child is not born in Florida, they must submit their U.S. birth certificate with the application. Legal immigrant children must submit all immigrant documents supporting their immigration status. It is not necessary for parents to submit documentation for themselves, as the program only covers children. So you say, how do I apply? To enroll, contact the local Kid Care outreach office to assist with an online application at 954-467-8737. Or you can go online at www.floridakidcare.org.
Thank you, Rebecca. That was very informative. I want Kid Care for my family.
Thank you for having me.
Hi, now we're with Billy Morgan from 211 Broward. Billy, thank you for coming and speaking with us today. We're going to learn a little bit about 211 services and what's available in our community.
Oh, wonderful. It's such a pleasure to be here. So we're going to talk a little bit about 211 and what we do, and really connect you to what, really connect the dots in our community on what resources are out there. Many times when I go out into the community, I find that there are some people out there that don't know what 211 is and what we do. So I'm going to share a little bit about 211, some of our many programs and services that we have, and in the end, you'll probably learn a few things yourself. So one of the things that 211 does is that we're a 24-hour information and referral helpline. We're free and we're confidential, so anyone can call us at any time they need in the community. Being multilingual, that's also really helpful, and we're Broward's really the lifeline for our community. And we have our finger on the pulse of what our community needs. We have a list of all the nonprofits all in one place, and it's just an easy to remember number. So one of the other neat things that we do is that being that lifeline, we are our suicide and crisis helpline for Broward County. So anybody who's in a crisis, or if you know somebody in a crisis, this is a number you need to remember. It's 211. So in addition to that, some of our community calls us, and we're a pretty busy helpline. We have over 100,000 calls a year in Broward County.
Wow.
And one of the things that we can also do is advocate and follow up with families and individuals who call us and make sure that they get connected to those very necessary resources in our community. So you might be wondering, what type of resources do we have, and what type of services do you offer? So one of the neat things that we have here is what we call a word cloud. And so when you see the word cloud, some words jump out more than others. For an individual, it may be some person might see food and say, you know what, I'm hungry and I need food tonight, or I'm working with somebody who, needs that service. Another one might be seniors, a person who is elderly who lives alone in Broward County. There are services for health and human resources. There are services for clinics in our community. And this is an easy to remember number and a way to link up to those resources. Another one that may jump out is abuse or bullying, childcare. We do all those things. And so this word cloud is kind of like that way for you to be able to see we do everything for our community, and we're here to help and connect. And we're absolutely free, so that's also a great thing. So what keeps us running at 211? We are a nonprofit, and we rely on our community to support us. And one of our biggest funders is Children's Services Council of Broward, and United Way as well, ELC, Broward County, DCF, Early Learning Coalition, Children's Forum, and Broward Behavioral, all part of that that thing that keeps us going, that funding that we have. And also municipalities and individual donors also give to 211 to keep us going, so we can keep helping our community with what's necessary. So some of our featured programs that we have, and I really wanted to highlight some of these, is our Child Care Resource and Referral Line. So families call us and they're looking for child care, after school care, summer camps, and they don't know where to begin. Well, now you know this number, 211, is where you can start. And we can actually give and email them a list of different programs that might be appropriate for their child, do screenings as well. And when I speak of screenings, developmental screenings through our Help Me Grow program, if you have a developmental concern for your child under age 8, then we're here to be able to help that family connect to what's necessary in our community, and also do a screening to make sure that they are meeting their developmental milestones. So some of the other things that we have, speaking of behavioral health and development, our info line is a number to link up to the resources for substance abuse and mental health. And when I say 211's for everyone, I do mean 211's for everyone. It's for all ages. So it could be for an infant, it could be for a senior, as we've discussed. And speaking of seniors, our Touchline program is a program that we do a daily reassurance call to seniors who live alone in Broward County. So if you know somebody, a neighbor, a friend, somebody at your church or temple that lives alone and needs just that check-in, tell them about 211 and our Touchline program. And it's 100% free. And we'd love to be able to call more seniors in our community. Another important one that we have is Mission United, which we partner with United Way to help our vets in our community who have served and who have honorable discharges. And what we do is an intake for them to be able to get the services and support that they need returning back. And when I'm talking about crisis, one of the two I want to highlight here, it's kind of a, sometimes a difficult subject, is suicide. And we're not afraid to talk about that at 211. And our Teen Space 211 is one place for our youth who can call us and connect to us, and our website, Teen Space 211, and as well as our Suicide Prevention Lifeline. The 800 number that you might have seen out there on a billboard or in commercials, that is us answering that for Broward County. And so in 211 is in 93% of our nation. So if you dial 211 wherever you are and you need to find help or hope, just remember 211, or you can tap into our Lifeline as well. Along with EITC and our Summer Break Spot program, our Special Needs Connections to help families navigate the system of care for special needs, we're covering a lot of ground. So we're here to be able to help anybody in our community and connect to those very essential resources, find help, find hope, and find resources. We're highly trained at 211, multilingual and empathic, and we empower and advocate. And again, we never close. 7 days a week, Monday through Friday, we're always there. So now you want to know where to go? It's 211. We're your first call for help, and I hope that, that I've been able to share some of the new programs and resources we have in our community just by dialing those 3 digits on your phone.
Thank you, Billy. That's been really helpful. I've learned so much about 211. I have one question about benefits. Can you talk about how people can access benefits through 211 Broward?
Oh, excellent question. So public benefits are easily accessible by just dialing those 3 digits. For example, if you're looking for where to go to find help with Social Security, 211, and you also have a website as well. So we have different keywords and ways to search on our website, and it's comprehensive as well. So all the resources that you need are at your fingertips, as well as through a phone call. So if you're needing help with SNAP or food stamps and you don't know where to begin or where that office is, we have 211. So the website is www.211-broward.org. And right there is another way that you can access us.
Okay, thank you so much. That's really helpful. And thank you for joining us today.
Oh, it's our pleasure. Thank you.
Now we're going to speak with Ismael Martinez of the Family Success Administration Division of Broward County Government to learn a little bit about the Family Success Centers. Thank you, Ismael, for being with us today.
Thank you, Julie. It's a pleasure to be here. Before I begin talking about the Family Success Administration Division, I wanted to talk about a little bit of Broward County and Human Services and how it's organized as far as our department goes. So underneath the umbrella of Human Services, we have 5 major divisions. The first is the Family Success Administration Division. The second is the Community Partnership Division. The third is BARC, or the Broward Addiction Recovery Center. The fourth is Elderly and Veteran Services. And the last division that we have is our newest one, which is the Office of Juvenile Services. So basically, the Family Success Administration Division offers services to the residents of Broward County through the Family Success Centers, the Community Action Agency, and the Housing Options Program. We offer assistance in the form of rent and mortgage assistance, utility assistance. We also offer long-term self-sufficiency case management. We offer financial coaching and financial well-being sessions. And lastly, we offer programs for the homeless through our Housing Options Program. So just to put things in context, the Family Success Administration Division has a $13 million budget, and we have approximately 103 staff persons on board. We have 4 centers located throughout Broward County. We have a Coral Springs location, a Hollywood location, a Pompano location, and also a Fort Lauderdale location. In addition to that, as I mentioned earlier, we offer services through case management. One of the services that we offer, which is probably the most popular service that we have, is offering emergency assistance and self-sufficiency case management services. These are offered to the residents of Broward throughout these 4 family success sites that we have through the entire county. In addition to that, we also have grant-funded programs that we offer assistance with. So we are not in isolation at these locations. We also have providers on site with us. We have many providers throughout the community, such as Legal Aid, Crisis Housing Solutions, the Health Department. We also have other county social service agencies that are located with us, such as our partner divisions within the county of Elderly and Veteran Services, the Broward Addiction Recovery Center, and the Office of Juvenile Services. Now, to qualify for emergency assistance, which again is our most common form of assistance, and that is basically where we go ahead and pay for anywhere between 1 to 3 months worth of rent assistance and utility assistance. And this can be assistance in the amount of up to $500. We also require 3 things for emergency assistance. The first is we have to have the person be a resident of Broward County for 3 months. So we have a 3-month residency requirement. There needs to be an interruption of income in the last 6 months of at least 10%. And lastly, there has to be some sort of sustainability plan moving forward. We want to be sure that once we help the Broward resident that they're able to continue making payments on their own. Assistance is also allowed once every 12 months or 3 times in a lifetime. And we have a general fund that is funded for this assistance of approximately $1.4 million. And what's important to know about this program is that assistance is situational. It is not need-based. In other words, it is not based on income. The Community Action Agency is another section of the Family Success Administration Division. And they offer 2 types of assistance. They offer assistance which is called LAHEAP and CSBG. So LAHEAP stands for Low Income Heating Energy Assistance Program, and CSBG is our Community Services Block Grant, which is a large grant that we receive every year. So in order to qualify for LAHEAP, a person has to be at the 150% of the poverty level. Unlike EA assistance, which is emergency assistance, this program is income-based and is not situational. In order to qualify for this program, the person needs to fall within these guidelines of financial eligibility, and these individuals, if they qualify, would receive assistance 3 times a year of up to $1,600 to go ahead and pay for their FPL bill. Money comes from the federal government in the form of a grant, and the grant for the LAHEAP program is approximately $4.5 million. In addition to that, if you notice when you get your FPL bill, you will see on the top right-hand corner a box that says Care to Share. And Broward County residents are free to check off that box. So whatever is checked off on that box as far as money amount goes, that money goes directly towards the Care to Share program, which directly funds the LAHEAP program. So we've talked about the LAHEAP program. The next one is the Community Services Block Grant, which is CSBG. Now, this program is also an income-based program, and the poverty level here is 125%, as opposed to the LAHEAP program, which is 150%. So what this program provides is assistance with job and education training, with books, with tools, with childcare and bus passes. So to give you an example, if an individual qualifies for this program based on the income requirements, we will go ahead and pay for vocational school. We would pay for their books. Let's assume they wanted to study refrigeration mechanic. Well, we would go ahead and pay for whatever tools are required to complete that course, that certification course for that individual. If a person qualifies for the CSBG program, we would go ahead and pay up to 12 months of child care for a person that is a full-time student at a vocational school, and we would also go ahead and pay for 9 months of child care if this individual is employed on a full-time basis. So the benefits are many with the CSBG program, and the amount of money that we get yearly from the federal government in the form of a grant is approximately $1.3 million, only because it is such a popular program. And I wanted to talk a little bit about the last program that we offer in the Family Success Administration Division, and that is our Housing Options Program. This program has a budget of approximately $500,000, and what it does is it prevents or ends homelessness to low-income families and individuals, and it also assists with move-in expenses and case management to address the barriers to housing stability for Broward individuals, residents. The HOP program, as we refer to it, manages 2 HUD-funded grants to assist individuals who are homeless and with a substance abuse disorder, and it also assists with hotel placements when emergency shelter space is not available. The last program that the Housing Options Program offers is a very popular one, and that is the Family Reunification Program. This program allows homeless individuals that live in Broward County to be able to go anywhere else in the country where there is a receiving family member or friend willing to go ahead and take them in and help them get back on their feet, per se. So that is the Family Reunification Program, where we send a Broward County resident that is homeless back to or to wherever it is that the receiving location needs to be. And that would be transportation that we arrange either in the form of a Greyhound bus ticket or an airline ticket.
Well, it sounds like Broward County really is providing a lot of services to people in the community. Thank you so much, Ismail, for joining us.
Thank you. My pleasure.
Okay. So we hope that you enjoyed learning about some of the benefits and entitlements that are available in Broward County. Special thanks to Broward Behavioral Health Coalition, Kid Care, the Florida Department of Health in Broward County, 211, and the Family Success Division of Broward County Government. This is Julie Radlauer Dorfler saying thanks for tuning in for another episode of the Cross Systems Training.